This is video 6 in chapter 9, joints. So in this video, we're going to take an in-depth look at one particular joint, and that is the knee. So the knee is classified as a hinge joint, which means it's uniaxial. And it is the most stressed joint in the body because it is a major weight-bearing joint. So all of the weight of the entire torso, head, upper limbs is all focused down the femur onto the knee. So with this, the landmark here that tells us that this is the anterior surface is this bone right here, which is the patella. I'm going to extend this out just a little bit so we can see the whole view of this. So the other bones that are present are the femur, and down here we have the small bone on the lateral side of the leg, and that would be the fibula. And then the large bone right here that articulates with the femur is the tibia. Now, the patella is located within this complex. So right here, we have what is known as the quadriceps tendon. And then extending from the inferior patella is the patellar ligament. So this tendon is part of the quadriceps muscle group up here, which you can write in, but you're not responsible for that. So the top of the patella is a tendon that attaches to muscle, but the bottom attaches bone to the tibia here on the tibial tuberosity, which is this little knob right here. That's a high stress area, so that little knob on the tibia is where the patellar ligament comes in. This is the ligament that when they check your reflexes, they hit, and it causes your leg to move outward. So because this is such a high stressed joint, we have several ligaments and features within the joint capsule. So remember that surrounding all of this is going to be a tough membrane that houses all of this and encapsulates the joint and filled with synovial fluid. So the surface right here of the femur is going to be articular cartilage. And that is also this one. I don't know why they have another arrow there, but it's there. Then if you look right here, we have a disc, like a crescent-shaped disc of cartilage. This is the meniscus. So this whole thing here is the meniscus. And then we have 4 ligaments. You can see right here's one, here is one, here is one on the side, and here is one on the side. This one right here connects the femur to the fibula. This is called the lateral collateral ligament, or LCL. The one on the other side is the medial collateral ligament, or MCL. These ligaments, it's much more common to damage the medial, which is on the inside, because if you get hit on the side of the knee and the knee buckles out, so this gets pushed in, this ligament gets stretched and can rip. That's a very common injury. It's less common to damage the lateral unless it is cut or you have a twisting motion to the knee, like if your leg were to be caught in maybe some kind of farm equipment. That the medial, because you normally get hit from the outside of your leg, and it's not as common to get hit from the inside of the leg and have this part buckle out. The two ligaments here, the one that starts on the anterior on the bottom and goes sort of angled backward, is called the anterior cruciate, which stands for cross ligament, or ACL. The one in the back that inserts on the tibia posteriorly is called the posterior cruciate ligament, or PCL. Now, it's much more common, probably the most commonly injured ligament is a tear to the ACL. And it usually is if you get hit in a certain way. This is not the strongest of ligaments and has a tendency to tear. It's not very common to damage the PCL. A lot of times the ACL and MCL are damaged together, especially in soccer and football. ACL injuries are very common in basketball because you plant your foot and then you go to twist or move and it just twists and it rips this. So you can have a partial tear of this or you can completely tear this off. Now for surgery, they do a lot of different things, and we're going to watch some videos of ACL repair when they do this laparoscopically or with an arthroscope, which means it's just a little camera that inserts in here and they use tools through different holes so they don't have to cut the entire leg open. They can actually use pieces of the quadriceps tendon to insert up through here in the same direction as this. So they use pieces of tendon, which is very similar to ligaments, or they can use a piece of the patellar ligament, or they can use cadaver material, and then they actually insert that through a drill up through here. It's a very interesting and very common surgery. So we will have some supplementary videos of that.